question was addressed. Question number 9, the Honourable Annette King.
Thank you, Mr Speaker. My question's to the Minister of Health. Does he stand by his statement that changes to doctors' fees is, quote, a problem actually that cannot be solved without more money, end quote? If so, why did he not put a budget bid in as, quote, pushed, end quote, to by Treasury?
Speaker.
The Honourable Pesata Sam Lotu-Iiga.
Mr Speaker, on behalf of the Minister, I did put in a budget bid for increased subsidies for doctors' visits, and with strong support of the Minister of Finance and the Prime Minister, we received an extra $25 million for primary care. This means that under this government, subsidies for doctors' visits have gone up over $230 million to $900 million in this year's budget. That's an increase of 24%.
Supplementary question. So is the Minister saying...
Order. Supplementary question, the Honourable...
So is the Minister saying that additional funding was put in for primary health care that will address the 434,000 high-need New Zealanders who miss out on affordable primary health care? If not, why not?
The Honourable Pesata Sam Lotu-Iiga.
Thank you, Mr Speaker. On behalf of the Minister, no, what I'm saying is that the government subsidies for doctors' visits have gone up $230 million over the last 8 years. That's what I'm saying.
You're not fixing the problem.
Supplementary
question, the Honourable Annette King.
What would move him to seek additional funding for the 501,000 adult New Zealanders who, according to the 2014-15 New Zealand Health Survey, are not accessing a doctor due to the cost, with fees going up from $29 a visit to $40 a visit, with some at paying $70 a visit under this government?
The Honourable Pesata Sam Lotu-Iiga.
Mr Speaker, what I can say about that health survey is that the unmet need due to GP costs for adults is unchanged for the last 3 years. And I can also say for Māori, particularly for Māori, the unmet need due to GP costs actually decreased from 22.5% to 19.7%, and that's where the funding's going.
Supplementary question, Mr Speaker.
Supplementary question, the Honourable Annette King.
Why would Dr Andrew Miller, Chair of Manaia PHO, be wrong when he said recently that looking after high-need patients isn't worth as much as non-high-need patients, and it's an appalling inequity, entirely unethical and illogical?
The Honourable Pesata Sam Lotu-Iiga.
Thank you, Mr Speaker. On behalf of the Minister, I can't speak for that doctor, but what I can say is that for very low-cost access practices, there's been an increase in the last year of $1.5 million, and over the last 8 years, in terms of those high needs patients, there's been an increase of over $20 million.
Supplementary question, Mr Speaker.
Supplementary question, the Honourable Annette
Why
King.
didn't he make a bid for additional funding for high need patients in this budget, when people like Dr Tim Malloy, the President of the Royal New Zealand College of GPs, said on Sunday, quote, having to decide between whether you eat or go to the doctor is actually a reality?
Mr Speaker,
the Honourable Pesata Sam Lotu-Iiga.
On behalf of the Minister, I want to reiterate what I said in the primary question, in terms of the primary question. There was a budget bid put in, and that resulted in $25 million being received for primary care over and above the amount that was paid last year.
Question number 10,